Just a few months ago, the Montana legislature voted here at the state capitol to renew Montana's Medicaid expansion. Now there's another debate underway that could again have a big impact on Medicaid in the state, this time at the federal level.
Medicaid is very important for the state's healthcare system.
Aaron Wernham is CEO of the Montana Healthcare Foundation, which recently completed an analysis into proposed changes to Medicaid in congressional Republicans' big bill and what they might mean for Medicaid in Montana.
We're forecasting what might happen. We're not saying that this is definite.
There are currently more than 200,000 Montanans enrolled through the state's Medicaid program. The Healthcare Foundation's report estimates about 31,000 could lose coverage in the first year. Most of those, about 27,000, would likely be adults on the Medicaid expansion program. The report estimates 60% of those losing coverage would be in rural Montana. The biggest changes would be increasing how often Medicaid recipients must confirm their eligibility and adding work requirements for those on Medicaid expansion. Montana's law has had work requirements, but they've never been implemented because the state hasn't gotten a federal waiver. Supporters of the federal bill have said the changes are aimed at strengthening Medicaid by ensuring only those who should be on the program are on it. Wernham says his concern would be that the effects might go further than that.
We project that for the simple reason that government's not perfect. It takes a lot of work for government to implement all of these new systems to figure out who's meeting work requirements, who's exempt from work requirements.
The report also estimates over the next 10 years, the state could see more than $5 billion less in healthcare spending for low-income Montanans. 80% of that could come from reduced federal Medicaid spending.
The federal government pays a pretty high share of our program. So that means as changes happen, we may lose a higher proportion of federal dollars than other states.
Once again, the final bill language is still being worked out. Republicans in Congress have said they hope to pass the bill by July 4th. In Helena, Jonathan Amberian, MTN News.